Well, hi, everybody, and welcome to the November 2021 edition of State Street Forum. This monthly conversation about faith and public life is co-sponsored by the New York State Council of Churches, the Focus Churches of Albany, New York, and the Westminster Presbyterian Church, where I am the minister. And today we have with us also Judy Hartley, who is the moderator of the Albany Presbytery and a member of Westminster as well. And we're going to, in a few moments, introduce everybody else who will be speaking today. But I want to just thank you all for coming. Note that we are recording, and this recording is distributed not just to the participants today, but the Council of Churches posts these recordings for use by churches and by others, individuals who are interested in finding a way to connect contemporary issues, things that are very much at the front and center of the news, and to really reflect on how churches and people of faith can interact with those issues as people of faith, how we bring a faith perspective to our interaction with public issues, but also how we can engage people who are policymakers and advocates as people of faith and just find language and perspectives and values and ideas that make it so those worlds that are so often distinct, not just in our world, but even in our own minds, that we find ways to allow them to inform each other and actually speak to each other. So thank you so much for coming. We find this work to be very interesting, and also every single time we get together, we are learning how to do something that's we think that the world really needs us to do. So with that, I want to just turn it over to Reverend Peter Cook, who will introduce our presenter this morning on our topic, which is the child care crisis in the United States today.
Thank you, Heather, and it's a pleasure to be here with all of you as we seek to address the big issues of our time and how we as a faith community can address those issues. And of course, one of the most prominent issues that we are dealing with right now is the child care crisis. And I can really think of no one better to be able to speak to these questions on the state and federal level than Christina Dozier. Christina is the executive director of the Children's Defense Fund of New York, whose policy priorities include income security, education justice, economic justice, child health, immigration, youth justice, and child welfare. Christina has a wide array of substantive experience in fighting poverty in state and city government on a grassroots level in partnership with unions and as a staffer for a Children's Defense Fund Community Development Corporation. Additionally, in a volunteer capacity, Christina helped to start her church's social justice ministry. And previously, Christina served as the chief of staff for a New York State senator, who was Brian Benjamin, now the lieutenant governor. Christina also worked for the nation's largest social services agency, the New York City Department of Social Services, as the Director of Community Affairs for the New York Department of Homeless Services. And at DHS, Christina was intentional about framing homelessness as a woman of color and children of color racial equity issue that is rooted in systemic poverty. Christina's entire professional career has been focused on fighting poverty. She was the New York City faith organizer for the Fast Food Forward, Airport Worker Economic Dignity, and Raise Up New York campaigns. And in each of these campaigns, the coalition that she was a part of achieved success at raising the wages of low-income workers in the fast food and airport industries, as well as throughout the entire state, through authentically engaging and organizing impacted individuals and communities. She received her Juris Doctorate and Masters of Business Administration degrees from American University in Washington, D.C., and she holds a Bachelor's of Business Administration degree from Loyola University in New Orleans, where she double majored in international business and economics from Loyola University. So with that impressive background and resume, it's my pleasure to introduce to you Christina.
Good afternoon, everyone. I am so grateful to be here today to talk about, to receive the invitation from Reverend Cook. He is one of the most faithful, committed social justice, human rights warriors that I have been blessed to work with. And so anytime I call on him to stand, with me and marginalized children and communities, he's always there. And so I definitely appreciate him and all of you who labor with him on this important work. I always count it a privilege to be amongst the faith community talking about these particular issues, because I am rooted and grounded in this work and guided in this work by my faith. And so for me, there is no separation between social justice and my actual faith. And so with that being said, I'll just go right into it in terms of talking about the child care crisis that this nation is not only currently in, but has been in for quite some time. And so before I start, I would be remiss to say that I'm so happy to be blessed to now be the executive director of Children's Defense Fund New York. And so we are an organization, that is focused on, making sure that, marginalized children can flourish, that leaders prioritize their well-being, and that communities have the power that they need in order to shape their present circumstances and their future. And so hope that you all will, look out for all of the work that CDF does and work in partnership with us as we continue to move forward to end child poverty and all types of racial injustice in this country. And so as it relates to the child care crisis. And so as I stated, the child care crisis is nothing new. Like many of the COVID-19 crisis issues that we're dealing with, the child care crisis has exposed the inequities that have plagued our society for generations. And so over the course of this global pandemic and economic recession, which is still ongoing, we see how and have seen how children have been completely displaced from schools and the protective environments that they go to school in, whether it's early childhood centers, whether it's elementary, middle, high school centers. And so many children were already struggling to keep up. And so they fell further behind because of a lack of space, internet access, and or ability of their caregivers to support them during the school day. We also saw communities struggle due to an inadequate health supports, healthcare system. Families struggled because caregivers lost their jobs, and children struggled because they were often treated as an afterthought. And all of these issues hit poor Black and Brown communities hardest. For many in America, this exposure was eye-opening and helped to shape, some of the public discourse that we are having now regarding the extent of racial, ethnic, and economic inequalities nationally and in New York. However, and I want to really press this point, the most pressing risk and barrier in this moment is that we will miss out on this opportunity to change the future for children and families throughout the nation and in New York. We cannot continue with business as usual. We cannot continue to push policies and enact laws that don't actually deal with root issues, that don't sufficiently address issues substantively and holistically. And so in this moment, as I hear a lot of politicians, elected officials say, we need bold leadership, we need bold legislation that actually helps us to move forward. And so while I'm hopeful, that public awareness of inequities and desires to change the trajectories for marginalized children remains permanent, we also know that in the past, society has encountered similar moments in the past and has not, delivered for marginalized people, communities, children like they need to. So this is a time of tremendous opportunity. And so as it relates specifically to the child care crisis, what I will say is that when I think about the child care crisis, I think about it as a racial justice issue. I think about it as a gender justice issue. I think about it as an economic justice issue. And I think about it as a woman of color issue. And so as it relates to racial justice, President Biden actually made this statement when he was talking about what he wanted to accomplish with the infrastructure bill, and then with also the human infrastructure bill, the Build Back Better legislation that we're, actively, pushing Congress to pass. He stated, for too long, caregivers who are disproportionately women of color, and immigrants have been unseen, underpaid, and undervalued. And what we also know about what people have been terming the caregiving economy, or the child care, early childhood education, and elder care economy, is that it is a predominantly low-wage industry staffed heavily by women of color. So when I talk about this being a racial justice issue, that's exactly what I mean when you think about who is the majority of staffers, what they look like, what their incomes are, and different things like that. It's a racial justice issue, and it's an economic justice issue, right? Because the median hourly wage for childcare workers is just over $11. I don't even know how someone lives off of that amount of money. And so that's why it's an economic justice issue. Some statistics about, what's been going on, over the course of this pandemic from the childcare perspective. So between February and April of last year, 360,000 childcare jobs vanished, 360,000. And employment in the industry in February of this year, in 2020, was down by 16% compared to a year ago. However, unemployment fell by 6% overall. So the unemployment in the child care industry is greater than what overall unemployment is. And so, for those particular reasons, this is an economic justice issue. Also, when you think about the fact that in order for our economy to get going again, you need parents, you need caregivers who are actually able to work and who need somewhere for their young people to go. And so with jobs disappearing, with childcare facilities being forced to close due to, economic reasons, due to, low enrollment throughout the pandemic, and also rising costs because, maintaining, the business during the pandemic, costs have gone up, right? Because you have to do all of the cleaning, the COVID cleaning, and all of those things. And so it's an economic justice issue. And so I remember last night I was watching New York Theological Seminary did this forum where they were talking about voting rights, but one of the issues that came up was the fact that, even though, we have a Democratic White House, we have a Democratic Senate, kind of, sort of, and we have a Democratic House, how the fact that we haven't been able to, to get to raise the age federally across the line is an actual issue. And so when I hear that the median hourly wage for childcare workers is $11, which is less than what people in the Fight for 15 movement are calling for, which is a $15 minimum wage. I just think about, the economic implications for low wage workers, for women of color, and that nature. And then I'll also share, just looking through my notes, what else? And then it is obviously a gender and, woman of color issue for all of the reasons that I already stated, how this industry is disproportionately made up of women of color and different things like that. And so, thinking about what I wanted to talk with you about today as it relates to this particular issue and aligning it with scripture, I am personally, a disciple of Jesus. Part of the Christian faith, but I honor and respect all those who practice some type of faith, as well as those who don't. But what came to mind was this issue of how do we make sure people are actually able to live whole lives and abundant lives, right? And so some of the language that Jesus spoke about, how he came so that people could have life, and have it more abundantly. And so thinking about what needs to happen legislatively in order to enable people to live the lives that, I personally feel that God created us to live. And so, what does that then look like? And how do we make sure we're creating legislation, not just creating legislation, but getting legislation across the finish line in a way that really enables people to live whole lives, people to live abundant lives. And I was also, drawn to, the Beatitudes and how, Jesus said a number of things about, the kingdom of God and access for people and different things like that. And just kind of thinking about how legislation, can actually, make real God's kingdom here on earth for people. And so when it comes to, what's needed to actually help the childcare industry in this moment to end this crisis once and for all, one, we need to make sure that childcare workers are paid a living wage. They are paid a living wage. Right before this, this recording started, I was speaking with Judy, who is here with us today, and she was talking about, fighting for, childcare workers, to have higher wages, fighting for, childcare workers to have, sufficient benefits and things like that. And so, so a lot of times I think when we hear these justice campaigns, right, about raising the minimum wage, making sure that workers have access to paid family and medical leave, which is also, what we're fighting for with the Build Back Better legislation. I think people kind of don't fully understand who doesn't have and who needs it, right? Like, you would think that someone who is taking care of, our most valuable resource, our most precious commodity, not want to say commodity, but but our most precious human beings, our most, vulnerable human beings. You would think that they wouldn't have to worry about how they're going to live, how they're going to pay their rent, how they're going to feed their families, how they're going to have access for healthcare and different things like that. And so really putting a face and a description behind legislation is really important. So I think for the child care crisis to end, in order for individuals to be able to be whole, to live abundant lives, those who work in that industry, we need to make sure that they have the necessary wages and benefits in order to actually help them with that. I know that another issue that has plagued the child care industry for quite some time is the fact that, they get government subsidies, to help them with the cost of child care, because that's another issue. The cost of child care is extremely high. And that also precludes people, especially people of limited economic means, from being able to access that necessary resource for them and their children. And so in preparation for this, I was reading various articles, and one woman talked about how in order to get a job, you need to have healthcare, for your children, in order to be able to work that job. And that's like an immediate need. And so like, how do you, between the time of like getting a job, getting the job and starting the job, how do you have enough money to even immediately be able to pay for childcare expenses? And so I know that the government, provides, childcare subsidies. And what advocates have been pushing for is that the actual subsidies that childcare providers receive is actually an amount that will enable them to be able to run their businesses in a high quality way, right? And so it's sad and it's tragic how when it comes again to our most valuable resource, our young people, how we don't want to pay childcare providers what they need in order to run their business. And so I saw so many accounts online when I was studying this issue, where childcare providers talked about how the director was basically doing 3 or 4 roles in order to keep costs down, and different things like that, in order to make sure that the doors could stay open, in order to make sure that they had, funding for food for the young people and different things like that. And so we just need to make sure that, when, on a federal and also on a state level, when we're saying this is the amount of childcare subsidies we're going to give to childcare providers, that it is enough that they can actually run high quality businesses and different things like that. I would also say, let me just kind of look over some of my notes that I put together.
And that might be a good place to just hit pause if you're okay. And we're gonna have somebody respond to what you're saying, and then we're gonna open it up for conversation. Is that okay, Christina? And we'll take it more broadly at that point. But I did want to give a chance for we have here with us Rebecca Richards, who's a pastor here in Albany, and she serves the Trinity United Methodist Church on Lark Street, not far from us here at Westminster. I'm going to put her in the spotlight here. Hi, Rebecca. It's been our practice for the State Street Forum to make sure that somebody who comes, really from the faith community, who's working hands-on with this issue that we're talking about, kind of responds from a faith perspective to what's often a policy response. Christina, you did such a beautiful job presenting your work with a faith perspective, but I would love to give Rebecca, you a few minutes to really, I mean, you're somebody who is on the front lines of this struggle in both personally and professionally, and I'd love to hear your perspective, and then we'll open it up for broader conversation and questions. Thanks.
When thinking about the child care issue from a faith perspective, all of the stories of women seeking out Jesus for comfort and healing for their children always comes to mind. Of course, Trinity houses a daycare. So as I'm listening to Christina speaking, I'm shaking my head because all of the issues are at play at our daycare. We are down in numbers. We are not able to have enough workers, hire enough workers in order to open what used to be 2 floors. We're down to 2 classrooms really in our facility. And we used to house 2 floors worth of children, plus a school program. And we're down to a baby toddler age 1-year-old classroom, and a 3- and 4-year-old classroom, simply because workers are not available. The pay is low. I don't fully understand, the being paid a living wage. These are all issues that hit hard the faith communities. And, in my own experience, I have 2 children. So when I started in Albany, it's that scramble to find where to place my children. Not only do you have to find the place, you have to pay for their physicals in order for them to start daycare. So the issue affects our congregations on many, many levels. I'm sure that there are members of our congregations that possibly are seeking daycare, possibly in this transition between starting work. I know for me, it was very difficult. I had not yet received my first paycheck, and I need to take my children to get a physical in order for them to be able to enter daycare. I also, while I was in DC, I worked with the homeless children's playtime project. So even women looking for work, which is essential as for single mothers looking for work who do not necessarily have families, that can take care of their children, or have been in many cases have been estranged from their families, to have a place while they go seek what will give them a living is important. And then from the perspective of just the high cost, I found in Albany, in the Albany area, the average cost of daycare is about $350 a week per week. So So Trinity Daycare is one of the lower rates of childcare, and we pay $285 per week. So put that into perspective of just the cost of for women to be able to afford daycare. There are decisions in families being made of whether or not to pay for daycare or be able to pay for food, I think in some cases, which I know many women have faced, that there are probably people out there, because there are qualifications for assistance in terms of how much you're earning. I know, as well as whether or not both parents are working. So both parents need to be able to be working in order for you to receive some of the subsidies that are available to people who earn just above the level of poverty. That level that I call this in-between level of living, where you're just above that level where you qualify for being below the poverty level according to governmental standards, but yet you're not earning quite as much as other people.
Maybe that's a good place to hit pause, if that's okay, Rebecca. I feel like our chat is just like also a fascinating set of conversations. Whoops. Sorry about that, going on as well. And so I really want to make sure that some of that gets addressed to our speakers here right now. So if you would like to address some of what you've put in the chat and direct it to a speaker, please go ahead and unmute yourself, and this would be a good time to open it up. I think we've done a fabulous job explaining just what a deep mess we're in. Like what a situation we're in where even working parents cannot afford childcare, and at the same time, the people who are doing this important service are not earning a living wage. You know, in a situation of fast food workers where, Christina, you were working previously, one of your previous campaigns, you know, the price is so low. Like the consumer is getting something for so cheap. It's not that surprising that the people who are performing the work are paid very little. But with childcare, those of us who pay childcare, it feels so expensive, just so impossibly expensive. And yet the people who are doing it are paid so impossibly little that it seems just like an enormous and impossible puzzle. Okay, well, that wasn't really a question. It was a declaration of just amazement. But who would like to ask a question? Nora, are you ready to go?
Sure. Hi, I'm Nora McDowell, and I'm a working mom. And now it just hit my lunch break, so I can talk. And my children are teenagers, and I was fortunate to have teenagers during the time of Corona. But so many women left the workforce. The she-session hit us hard. And I'm also on the board of the Boys and Girls Club of the Capital area because I became a mom member who needed that affordable daycare. But I'm aware of our struggles even in hiring staff. A lot of the things you presented on ring so true. And New York, we've raised the minimum wage, but a lot of contracts are still based on a federal minimum wage. So the money just doesn't quite match. And sometimes when it comes to after school programs, especially, the hours don't match. That how does somebody make a living working 5 days a week and being there from 2 to 5:30, not even maybe getting up to 20 hours a week. So it can be really hard to find people. And I'm also struggling as a woman who got vaccinated but has friends who are hesitant and access, and also hesitancy about vaccinations was much bigger in Troy and Albany, Schenectady, in our inner cities. We don't have pharmacies in Albany. I mean, that's crazy. But also it's impacted that, Hackett Middle School had to go virtual today. So the kids most in need of being in a building are not in a building. And that really hit hard. And the Boys and Girls Club of the Capital Area, we were able to, because of some Corona funds, open programs in some of the affordable housing complexes like Municipal Housing Authority during that time period. But those aren't accessed now on these sporadic, days out or what happens after, because schools have switched so much more to a virtual basis when needed. There's no more snow days, folks. They'll make you do virtual school from home, and that counts on internet access and someone able to be there to make sure the kid is able to connect and get to school virtually. So I just thank you for having this. It is a really big issue, and it's beyond throwing money at school districts. It needs to come up from the ground as far as like wages and requirements and helping people get connected, because it can be quicker to get other service jobs that don't require background check, don't require education levels, don't require a car to get there. And so the quality of daycare is floundering. I'm going to be honest, of folks able to do this job. And sometimes even yeah. So I guess I just want to thank you for having us, and just say, keep in mind after school programs and pushing schools to fund contracted after school programs and daycare centers, as well as unionized workforces. Maybe it needs to be a unionized
Christina,
workforce.
Thank you, Nora. Christina, I wonder if you would want to respond, especially to the issue of employment, like how to stabilize employment, how to promote employment within this industry, where we can't bring the centers back if nobody's willing to do the jobs, as like Rebecca was saying, just trouble finding people who are willing to do that work. Is there a policy response to that?
Yeah, so thank you so much, Nora, for all of your comments and feedback, and for what you shared about your own personal journey. You hit so many things on the nail, and so absolutely. So, for example, I know one of the policy initiatives that was being pushed was that typically with childcare centers, when you get subsidies from the government, is based off of like how many children actually show up on a particular day versus like with public education, you get a particular amount of funding for your students, whether someone misses a day or not, right? Whereas in the childcare industry, that's not the case. Like if a child doesn't show up because they're sick or different things like that, then you don't get that funding. And so I know that waivers were being instituted during the pandemic to make sure that whoever was on your roster, no matter if children showed up or not, you would get that funding. Also know that some childcare providers were available for PPP funds. Also on a local level, they were available for like, small business funding, which obviously, isn't doing enough. And so what I will say from a policy perspective, on a state level, there is the childcare availability task force. And so they actually put out a report that includes an action plan for what a strong and equitable childcare system would look like in New York. And so they list a number of, various like policies that would need to be instituted in order to make sure, that our childcare system is strong and equitable, and also that those who work in the actual system have what they need and different things like that. And so it's a really just really transforming that system. And it's a very detailed report. I would encourage people to read that. Then I'll also say from a federal perspective that the Build Back Better Act, which everyone is, I won't say everyone, but a lot of people are focused on, it would possibly expand subsidies for childcare. It would create, free universal pre-K. It would provide an expanded tax credit for parents with children, and it would provide an increased earned income tax credit for this says childless low wage workers. And so there's a suite of, various policies. I would definitely encourage, people to be focused on the Build Back Better, legislation. Really encourage you to, to be calling your congressional members, letting them know that, child care is vitally important in order for us as a nation to be able to build back better. There are like people have been saying once in a generation investments that the federal government could make in childcare and in the childcare system if Build Back Better actually gets passed. So even if you think about, the expanded child tax credit that has been going into the pockets of not just the lowest income families, but also people who, I think it's like if you're making jointly like up to 150,000 or something like that. I forget the particular numbers, like you're getting, extra money each month, for your young people and for your children. And with that funding, people have been using it, for, I know in the summer for not after school, but for summer activities and different things like that. That money could help a family be able to actually, put their child into childcare and different things like that. So just kind of really thinking about this, in a very broad way. And I think based off of the childcare availability task force in New York, along with the provisions in the Build Back Better legislation, if we're fighting on a state and on a federal level for these things, then we can have more justice, more equity in the childcare system, not just for those who want to put their children in the system, but also for those who, for those who are running systems and who are working in systems and stuff like that.
What I'd like to, just building on what Christina said, I'd like to direct this question to Rebecca. So I'm just doing a little math here, that at $350 a week for 52 weeks for 2 children, that works out to $36,400 a year. 36% of your income, if you have an income of $100,000, would be what you would need to spend 36% of your income on childcare. Now, a house, the recommended percentage is 33%, where you are paying more for a mortgage or for childcare than a mortgage on your house. And notice I use the figure $100,000, which is not like a small amount of money. And a lot, I know pastors make at least that, but sorry, just kidding. You know, this is rough. So my question here is, how does the math work that you at Trinity Methodist, if you're charging what is it, $285 a week, to what prevents you from paying like a really good wage to your childcare workers, even at that? And what prevents you from having enough customers?
Well, that I know. So the director, our daycare has become a separate entity from the church. So it is no longer Trinity's daycare. So part of that is they do pay kind of the facilities
Right, they pay
in
for
part.
Right.
Well, it's not rent. It ends up going back kind of to pay lighting, heating
Yeah, right.
in these
exactly.
larger buildings.
Right.
So I would say a good part of what is being brought in is going to pay for facility, because you do want an upkeep on your facility
Right.
for the daycare. I know she has given our workers, the workers here at Trinity, a raise recently. She is there, they are earning just above state minimum. So, and that she does receive many subsidies, or many children who receive subsidies from the state programs that are available. So the math, I think the reality is the math does not work for families, even given all, I mean, I pay about half of my income goes towards childcare,
Right.
because I do not qualify for any state subsidies. I pay probably more in childcare than I do pay for rental at this point in time. When I lived in Massachusetts, I almost paid 3/4 of my paycheck would go towards childcare.
Mhm.
So Albany, I'm paying half of my pay. In other states, it's even higher. So this is a real justice issue, because the math doesn't add up. And there are other expenses to running a daycare than workers. So the workers are not earning enough in order to recruit new workers. Plus, many of the workers here have their own children. So it becomes a question of what do you do? It's a vicious cycle of, if you have workers who then need childcare, it's a cycle.
Yeah. So Christina, I'm wondering, given that whole thing, what do you think Build Back Better would do to alleviate this problem? They would like give, it's what, 7%? No family would have to spend more than 7% of their income on childcare. I think that's one of the, so presumably that would mean a generous subsidy from the government to supplement that cost, right? Plus, how do they deal with wages for childcare workers?
So I would have to look that up more. So to speak to some of what Rebecca said about cost. So like one of the things that I read was the fact that with the childcare system, like it's like one teacher for every like 4 children or something like that. So when you have those types of ratios, it requires, a larger like staff level than like, say like public education's an older child. And so then your staff costs are high. And then also the fact that, based off of the pandemic, your cleaning costs have like gone up. And so people are already on like shoestring budgets. And so it just makes it cost prohibitive for the childcare facility to stay open. And so I do believe that, the childcare subsidy could help out a lot in terms of, one thing I keep reading or seeing is that, we need to provide subsidies at levels that that actually meet the childcare operational need, right? And so, for example, like I know when I was in the city with the Department of like Homeless Services, and so one of the issues like we continuously would run into is that, we have like a homeless crisis. And, people think that, oh, it's just the people on the street, but, overwhelmingly it's children, families with children. There's a population in there who are working, who just aren't making enough, right? And so you provide them housing subsidies, in order to add to the income that they have, and so that they can afford, to live independently. And so one of the issues that we were running into was the fact that housing costs were increasing and so high, right? And so it's just like making sure that the subsidy that a person received was for an amount that they could actually find a dwelling place or an apartment, for them, for their family. And so I see it the same way as it relates to the childcare crisis. We're saying that we're going to provide childcare institutions, childcare, families, subsidies, in order for their young people to be able to be in a childcare facility. Then we need to make sure that the amount of that subsidy is in alignment with what the facility would need in order to pay their workers, be able to operate, at a particular level or whatever. Because if you're giving somebody a subsidy and, it doesn't do that, it's helpful, but then there's all of these other issues, that happen with this. So like, how do we make sure the subsidy amount is sufficient to help not only the parent, but also the childcare provider?
That's like such an obvious solution that it seems mind-blowing that that doesn't happen already. And then as soon as I say that, we think of, for example, Section 8 housing, where, the subsidy doesn't necessarily match the market or the availability of housing in the area in so many other rental support kind of things. I'm wondering if anybody else has one last question. We just have 5 minutes left, and we do commit to beginning and ending on time. Is there one more question from the group here? So we have a question in the chat there from Fred. What is the impact of public schools expanding to provide pre-K services? In Connecticut, that was a problem. Christina, can you speak to that?
Sure. Yeah. So because I think to Fred's point, you do have a number of childcare providers who operate out of like residencies and different things like that. And so, which, they are, legitimate businesses. Again, if we want to talk about, racial justice and economic justice, a number of those types of facilities are run by like women of color of a certain types of means. And so, if you're expanding providers to just public schools, then that's going to impact those entrepreneurs and different things like that. And so you just want to make sure, and I will have to like research it from a policy perspective, that those types of entities would be able to be protected and would be able to access some of that funding and different things like that. But that is a legitimate concern, and that would have to be worked out in the legislative process.
Well, if you look at it, the economics, as the child gets younger, the economics get worse because of the regulations and staffing. Other thing is that in schools, there's no means testing. So that if in Connecticut, schools, the public schools expanding into pre-K was becoming a serious threat to the economic stability of the private sector. And I've been away for 5 years now. I was served on the board of our church's childcare facility, and it was impossible. Infant and toddlers, which is at least as important as pre-K in the development of young children, is the most expensive service to provide, and the one that gets the biggest attack on providing babysitting services. So that it's kind of I'm new to New York, and so I don't know everything's happened here, but I was into it in Connecticut, and it seemed to be a circle that did not bode well for private suppliers.
Well, I'm afraid like this is really tantalizing. We need at least another hour, but we are going to wrap up, and we like to end with really specific action steps as much as possible, so that all of us can leave with something to do today. And the main action step I heard from you, Christina, was to really advocate for Build Back Better at this point is the most relevant legislation and potentially the most transformative, federally right now, and it would have a huge impact on the state as well. Would you agree that that's the main action item at this point?
Yes, definitely the main action point is the Build Back Better. And I'm also like hyper local focused. And so what I will say is that the state has received federal funding in economic stimulus to deal with some of the childcare crisis issues already. And so we want to make sure that the funding that they have received that when they spend it and different things like that, they really take into consideration what the child care availability task force mentioned in their report that they should do in order to help in this particular way. So I think absolutely like congressional leaders as it relates to Build Back Better, but then also reaching out to your state officials and saying that, we have to have a strong and equitable childcare system. And with the funding that you've received, and hopefully you will receive, we want it to be in alignment with this task force report. You can reach out to the governor stating that, because she was this was before she became governor, and she was part of this particular task force. So like holding her accountable to that, I think is also super important.
That's powerful, and I'm going to do it today. And I really appreciate you taking the time, and each of you for taking the time to engage with this conversation today. I would add one other action item that this conversation has brought to mind for me, which is to connect with the parents I know who are paying for daycare and to acknowledge the stress that they are under right now. And I think, it's been some years now since my kids were in daycare. And I tell you, there is a certain don't look back quality to once you get out of that phase of life. And this is a pastoral concern for me. And I hope a community care concern for each of us who's in relationships with parents with families to make sure that they don't feel isolated and alone in this struggle, but that they understand that there is a community and indeed a church community that surrounds them with support and is advocating actively on their behalf. Thank you all for your time. This recording will be available probably by this afternoon up on the Council of Churches website by tomorrow, and invite you to share it with anybody who you think might find this conversation helpful. Any closing words, Peter? Whoops, just unmute there.
Say that this whole crisis really does require a government response, and that the church in past years, like with the New Deal, really stood up and said, we cannot do this through charity alone. The government has a responsibility to deal with these structural economic crises. And at that time, it was because of elderly people who had no retirement and could not just rely on the charity of the church, and the church stood up for that. And we are in that moment now when it comes to childcare, and the church needs to speak up loudly. So,
amen. Tune in next month. We'll be taking on housing next month, as if we are not haven't complicated life enough. We're going to take a look at the crisis around affordable housing and eviction this time next month in December. Be well, everyone, and blessings, Christina, on your work and on your advocacy. We appreciate your time with us.
And Dorothy
Thank you
just
so
joined us
much.
a little while ago. She's on the board with the council. She's right back here.
I'm sorry, say that again.
Dorothy Pierce just joined us a little while ago, and she's back here with me.
Oh, great. Hey, Dorothy. Good to have you here.
Good to see you.
So.
Good to see everyone.